Polycystic kidney disease not only affects the kidneys, it could affect the brain, it can affect the liver, it can affect the pancreas. So there are lots of other organs that can be involved. So I usually end up talking with them about where their kidney function might end up without treatment. A healthy lifestyle can help with reducing high blood pressure, keeping weight under control, reducing the risk of diabetes, reducing further risk on the kidney when they're already susceptible to risk based on the polycystic kidney disease. So by having a diet that's rich in whole fruits and vegetables and whole grains, lower salt, lean proteins, it is important to hydrate. And especially it's important to hydrate when you're taking medications like the vasopressin 2 receptor antagonists. Ultimately, patients should at least get half an hour of exercise in almost every day, or at least 5 days out of the week, to help with maintaining a healthy weight and preventing diabetes and worsening of the hypertension. The goal of the vasopressin antagonists is to help with reducing the cyst formation. As we reduce the cyst formation, that's supposed to translate into less of a decline in the kidney function over time. For blood pressure medications in polycystic kidney disease, we do recommend medications like ACE inhibitors or angiotensin receptor blockers, so ARBs. Those two classes of medications end up working on the hormonal mechanism within the kidney, and that allows for better blood pressure control in polycystic kidney disease. So when it comes to managing pain in chronic kidney disease, we end up recommending acetaminophen. It is largely kidney friendly, but we do have to be careful about it. And especially we have to be careful with liver toxicities as a result of acetaminophen. We stay away generally from the non-steroidal anti-inflammatory medications, which do affect the kidneys. In patients who have more significant pain as a result of the cyst formations, sometimes patients may need to have the cyst aspirated if the cyst is causing a lot of compression and pain. So we do work with a team of interventional doctors as well as pain management to help manage a PKD patient's pain. If a patient starts having issues with volume control, like fluid control, or electrolyte problems, then we start considering dialysis. There's hemodialysis, and there's another type of dialysis called peritoneal dialysis. When I see that the kidney function is going down to less than 15%, I do refer them for transplant. And a lot of the PKD patients do very well with transplant. With early treatment and aggressive management of risk factors, our hope is to try to reduce this progression to end-stage kidney disease. There's a lot of research being done for additional medications and additional treatments to slow this progression down even further. But even if progression happens, we still have options when it comes to transplant.